Good evening, everyone. Sarah Edelman is a clinical psychologist, author and trainer. In her private practice, Sarah predominantly sees patients with anxiety disorders. She also facilitates training programs for mental health professionals, government and business organisations. Sarah has published many articles in professional and mainstream journals and is a regular guest on ABC Radio. Her first book, Change Your Thinking, is a bestseller in the self-help genre. Her other books include Good Thinking, A Teenager's Guide to Managing Stress and Emotions Using CBT, and also No Worries, A Guide to Managing Anxiety and Worry Using CBT.
Okay, thank you. Thanks, Anne. I'm glad we sorted out some of those technical issues. So, just talking a little bit about living with Meniere's disease. It's definitely not easy, and I'm sure every person in this room has gone through a fair bit of stress and sometimes trauma, just coming to terms with being diagnosed. The diagnosis is complex and sometimes difficult to make, and the trajectory of the condition is uncertain. We know that symptoms vary from person to person, and some people have mild symptoms and can manage them really well, and some people have more severe symptoms. And symptoms can be intrusive, they can be unpredictable, and sometimes they can be quite disabling, where it feels difficult to function. The other difficulty about it is that there's no cure, or certainly not at this stage. And the focus is on learning to manage the symptoms as best you can. And of course, when you look at all of those things together, it's stressful. Most people who have Meniere's disease have dealt with anxiety and sometimes low mood and sometimes even depression. So when we look at the components of Meniere's disease, most people with Meniere's have, well, virtually everyone, I guess, by definition, have vertigo episodes. You experience fullness in the ear, you experience hearing loss, you experience tinnitus. They're the most common types of symptoms that you have. But in addition to that, many people experience other symptoms as well. And the sort of things that people often report are things like just being dizzy and unsteady even between vertigo episodes, feelings of fullness or heaviness in the head, not just in the ear, but fullness in the head, rocking sensations, headaches, nausea, fatigue, neck pain, tightness in the chest, and a whole lot of other symptoms as well. And many people just assume that that's part of Meniere's, that's part of the Meniere's experience. One of the areas I've been particularly interested in, particularly I guess over the last 20 years or so, is PPPD, and I'm sure most of you are familiar with that. This is actually a relatively new diagnosis, originally called phobic postural vertigo. We started sort of seeing cases of it, but it was poorly defined. In 2003, it was defined, or it was labelled chronic subjective dizziness, and in 2014, we had submissions from all around the world. And researchers came up with the term persistent postural perceptual dizziness. And this has been categorised in the diagnostic manual, the ICD-11, which is used throughout Europe and England. And they refer to, so PPPD refers to experiences of dizziness, rocking, swaying, unsteadiness, but not vertigo. So if we're getting rotational vertigo, that's not part of PPPD, even though it's very often a trigger for developing PPPD symptoms. The symptoms last for prolonged periods, but may wax and wane in severity. Symptoms may occur without provocation, but they are exacerbated by upright posture, active or passive motions. So when people move their head or look down, they'll often get more symptoms. Symptoms are worse with exposure to complex patterns. So people often complain when they're looking at their computers or watching TV and seeing motion that can trigger them. And symptoms cause significant distress or functional impairment. Now, in my experience over the years seeing people with PPPD, I see a whole series of additional symptoms, including the lightheadedness. People talk about swaying, feeling unbalanced, unsteady, veering. People sometimes complain about the ground feeling unstable. It sort of feels like you're not solid on the ground. People experience dizziness with head and body movements. That's often quite common, as I said, looking up or looking down or looking to the side. People complain about fullness, heaviness, cloudiness in the head. And very often their symptoms are worse when they're in busy public places. So one of the questions I often ask is, are they worse in shopping centres? Are they worse in the supermarket? And if it's PPPD, that is very, very typical. Symptoms might actually reduce with distraction. And interestingly, driving is often an interesting sort of test. So people who have perhaps driving anxiety anyway will say, oh, look, I feel worse when I'm driving. But quite a lot of people with PPPD will actually say the symptoms are not bad when they're driving. And sometimes they'll be bad when they're passengers, but not bad when they're driving. And I think what that really reflects is the tendency that distraction actually can improve symptoms with PPPD. And most people will say they feel worse or tired, worse when they're tired or when they're stressed. So question is, what's going on there? What is PPPD and how does that actually relate to Ménière's? Well, we know that there is usually a trigger for PPPD, and I would say, and again, this is just an estimate based on cases that I see, I'd say probably about 80, possibly 90% of people start PPPD with rotational vertigo. And the rotational vertigo can be Ménière's or benign positional vertigo or vestibular migraine or vestibular neuritis or even cervicogenic vertigo caused by the neck. And that's kind of traumatizing and scary for most people. It can also be an acute medical event, so an adverse drug reaction. It can be arrhythmia. It can be postural hypotension to do with blood pressure. I've seen it with following whiplash, car accident, concussion, etc. And in some cases, and again, this probably be about 5 to 10% of people who develop PPPD, it just starts with anxiety. They never actually had vertigo, but vertigo is very often a trigger. And because the experience vertigo or these unpleasant physical experiences are scary, it tends to create vigilance. So most people then start to focus on the symptoms themselves. They start to, their attention becomes internal. I want you to think about your own experience with Ménière's. And my guess is prior to Ménière's, prior to those symptoms, most of your attention was external. And sometimes you might feel stressed or anxious, but it was always likely to have been about things happening in your life, relationships, finances, work, running late, but it was always about stuff that's external. Once we have these unpleasant, scary internal sensations, we start to become much more internal to what's going on inside us. And suddenly you find yourself being vigilant. How am I feeling? What's going on in my head right now? And that focusing on internal sensations perpetuates anxiety, but it also magnifies the sensations. Now, there are psychobiological processes that we really don't fully understand. It has to do with the limbic system. I'll talk a little bit about the anxiety processes, but we don't really fully understand how negative aversive experiences plus anxiety then often create a trajectory of ongoing dizziness, imbalance, and that weird cluster of symptoms that seem to come and go at various times. So typically it becomes a self-perpetuating process that is very often started by vertigo. Because the experience is scary and distressing and disturbing, you become very hypervigilant to the sensations of vertigo. And through that process, you tend to get an increase in somatic symptoms. I'm going to talk about somatic in more detail shortly, but somatic basically means real physical symptoms in the body from the brain. And that includes things like dizziness, unsteadiness, headaches, fullness in the head, fatigue. Fatigue's, by the way, really common. Sometimes visual disturbances, sometimes other things. And of course, when you have those sort of unpleasant sensations, it's normal to perceive threat. And typically people might start thinking, oh no, you know, am I going to have vertigo? How do I stop this? Will I ever recover? Will it take over my life? Sometimes people worry about how they're coming across to other people and worry about, you know, will people notice? Will they think there's something wrong with me? And of course, when we have threat perceptions, it makes us feel anxious. And in fact, when you look at what is anxiety, anxiety is perception of threat. And so the anxiety produces somatic symptoms, which are perceived as threatening, which keeps you in an anxious state, and then it can become this self-perpetuating cycle. And for people with Ménière's, quite often people are dealing with both. You know, they have the PPPD alongside vertigo and other Ménière symptoms. We know that there is a strong relationship between anxiety and dizziness. We know that anxious people are more likely to just experience dizziness anyway. So anxiety often triggers dizziness, but also we know that people who experience a lot of dizziness are also more likely to be anxious. And patients with pre-existing anxiety are much more likely to develop long-term dizziness following a triggering event. I use the word dizzy, and I know there have been different definitions of dizziness versus vertigo. So when I'm talking about vertigo, I'm in this context talking about rotational vertigo. When I'm talking about dizziness here, I'm talking about woozy feelings of unbalanced, uncomfortable, unpleasant, but we're not talking about spinning. Many patients have both a neuro-ontological, in other words, from the ear or central nervous system condition, like vestibular migraines, plus PPPD. And anxiety tends to exacerbate symptoms, and as does stress, as does fatigue. So now just a little bit about anxiety. And just before we go on, perhaps we have time for 1 or 2 questions. If anyone wants to ask anything about the PPPD, I mean, it'll be linked to what we're talking about anxiety, but if anyone's got any specific questions, just feel free to put it in the chat box. And if I don't see anything, we can just move on. Okay. Move on. So now let's see the connection and what exactly do we mean by anxiety. And in fact, it's interesting that sometimes I see people and they say, but I'm not anxious. And sometimes that's the case, but very often people don't recognize anxiety within themselves. And they'll say, well, you know, people tell me I'm very calm, but it's not actually what people tell you or what people see, it's how you're feeling inside. And when we look at what exactly do we mean by anxiety, anxiety is just a response to perception of threat. So we feel anxious when our brain is telling us that we are unsafe, that there is some sort of threat in our lives. And the limbic system, and I'll talk a little bit about that in a moment, the limbic system is giving us messages of danger. So something bad can happen, that's the messages we're getting. And as a result, it mobilizes a physical response. So anxiety is physical, it's in the body. Anxiety does not stop at the neck, it's a whole body experience. And in fact, anxiety is one of the most physical of responses. And we can have when we perceive threat is immediate. So if you feel like you're about to have for example, an immediate, you're about to have a rotational vertigo experience, you might sort of go into fight or flight, you might experience panic, or threat can be future threat. And when you're thinking about, when you perceive threat as being something in the future, you tend to be more vigilant. And I'll talk about those in a moment as well. Okay, I just checked for chat box for a question, but all good. Okay, so a little bit about what's going on in the brain. I'm sure many of you have heard of the amygdala. The amygdala is one of the key structures within the limbic system. The limbic system is that part of the brain that controls emotions. There are a number of structures within the brain, but the amygdala is probably the most important. The amygdala is like a smoke detector. It is constantly monitoring for danger. And when you're in an anxious state, or if you tend to have an anxious personality style, your amygdala goes off more readily and more frequently. even if you didn't start life as an anxious person, sometimes having something traumatizing, and especially having lots of random vertigo episodes, can actually make you more anxious by nature and can actually make that amygdala a little bit more reactive. And that means that it's sort of the alarm bells are going off more frequently. Just by the way, we also have a different part of the brain, prefrontal cortex, which is in general terms located at the front part of the brain, which is the executive functioning, and it controls many functions, including planning, goal setting, analysing, thinking, deductive reasoning, etc. So while this is a diagram, here is some actual brain scans, and here is a brain scan with low amygdala activity. This is done. It's looking from the top down, so you can see there the eye sockets and the nose there. And looking down, you've got one amygdala on both sides, and you can see that almost looks like a bat with open wings. It's very symmetrical, but when we experience anxiety, you get that change in brain activity, you get asymmetry. Also, you notice that a lot of the activity subsumes or comes over the prefrontal cortex. And as a result, we find it hard to see things rationally. It actually affects our ability to think rationally and to see things in a rational way. So I talked about two states. One is an immediate threat. When we have immediate threat, we go into fight or flight. And I'm sure all of us have had experiences where you start to feel perhaps panicky or highly anxious, and it feels like the threat is right now. And typically, one of the things you'll notice is that your heart is pounding faster, you're releasing adrenaline, you feel aroused and tense. Your muscles become very tight, and your breathing in particular becomes more rapid. It is a really unpleasant state to be in. But for most of us, fight or flight actually is reasonably short. So we might go into fight or flight sometimes for 10 minutes, sometimes a little bit longer. But we can't sustain fight or flight for days or for weeks. So fight or flight is more when our threat, the perception of threat, is immediate. But when we have more ongoing threat, we go to what we call the vigilance response. So it's sort of like halfway to fight or flight. So we haven't got that same amount of adrenaline pouring in, but we're kind of feeling nervous. We're feeling edgy, nervy, uncomfortable. It's hard to wind down. It's hard to relax. And we call that the vigilance response. And when we're in that state of vigilance, we are much more likely to develop somatic symptoms. And I mentioned somatic before. Somatic is in the body, real physical symptoms, not imagined, real symptoms, but from the brain, and in fact being caused by high levels of arousal. And typically they include things like dizziness, wobbly legs, heat surges, can be neck pain, headaches, nerviness, I mentioned, difficulty breathing, fatigue, diarrhea, tremor, twitches, disturbed sleep, chest tightness or chest pain, nausea, irritable bowel, tightness in the throat, tooth grinding, and TMJ pain, jaw pain. Often that comes from grinding teeth as well. So these are all typical somatic symptoms. I'm sure all of us, including myself, have experienced some of these at different times. And sometimes you're aware, you can sort of see the link with stress or anxiety, but sometimes we actually aren't, where you're experiencing some of these symptoms and you sort of don't realise that you have anxiety or that anxiety is causing it. By the way, when I actually see people who tell me they're not anxious, how do I test whether they are anxious or not? Or what I ask them to do is close your eyes and just take a minute and just notice what's going on for you. And if you close your eyes and you notice what's going on for you, if you're anxious at the time, you'll see a whole lot of tension. You'll notice that there's tightness in the chest or tightness in the stomach, or there'll be physical tension somewhere. Often we're not really aware of that until we close our eyes. So that can just be a useful test, just to see if there is anxiety. So I'm going to talk very briefly about a study that we did and that was published in 2012. I think we started in 2010. And we just tested a very brief intervention for people who had PPPD and we published it in 2012. And we just, as I said, it was 3 sessions. And through those 3, as a result of 3 sessions, we found a reduction in dizziness and physical symptoms. We found a reduction in disability. So one of the things, of course, with some of these physical symptoms is that they actually stop people from getting on with their lives. So one of the real focuses as in tonight's session, as well as in our program, has always been about, trying to have interests, get on with your life, do things, and try and reduce the avoidance. And so we also noticed a specific reduction in avoidance behaviours and safety behaviours. And we did a follow-up at 6 months, and people who did the program actually still had benefits at 6 months. So I'm going to just, the rest of much of today is going to be just telling you exactly what we focused on and what the program was about. And involved, part of it was psychoeducation, just understanding what's going on for you. What we call formulation, just being very specific and thinking, okay, so how did this start? When did it start? What actually happened for me once I started getting, for example, vertigo? And when did I start getting dizzy? So kind of understanding the processes. Part of what we did was we started getting people to increase exposure to some of the situations that they were fearful, and also to some of the sensations that are unpleasant. But I'm going to talk about this in a little bit more detail. We encourage people to just surf the symptoms, to not fight the symptoms, to not resist them, to actually learn to go with them. And also to start noticing your own mind, because often what happens when you're in that state is you're overthinking, overanalyzing, you're too much inside your own body and too much inside your own head. So just starting to observe your own thought processes. And finally, just setting and pursuing meaningful life goals, really just thinking about what's important to me. Okay, I might have Ménière's, but I am not Ménière's. I still have many other things, there's many other parts to me, and we'll talk about that in a little bit more detail as well. So one of the first things that we did in this study was try to reduce threat perceptions, and part of that involved a flyer on which just provides information about PPPD. And I don't know whether you've got, you don't have to answer me now, but I'm not sure whether you've got that flyer, but I'm happy to send it, and you can just put it on the website. So it's just information about PPPD and how it starts and what perpetuates it. And again, it's a 4-page thing that just explains some of the things that we can do. It's useful for people who have a pre-existing condition to distinguish what is Ménière's and what is PPPD. And some of the people I see will say, look, I know what's my benign positional vertigo, and I know the difference. I know how they feel different. And that's actually useful, so that you're not perceiving all of your symptoms as being Ménière's disease. We're trying to encourage people to also monitor their safety behaviours. And when we're anxious, we invariably do a whole lot of things to try and make ourselves less anxious. And for people with dizziness, they might start, I guess avoidance is the most common. They might avoid going out very often. They might avoid social activity. They try and avoid busy public places or shopping or driving. And one of the things I remind people is, unless you have specific medical instructions that you can't be driving or shouldn't be driving, there's no reason. If you drove before, you can still drive. And in fact, as I said earlier, for many people, when they start driving, they actually are distracted from their internal state, and they actually often feel better, or certainly no worse. Just repeatedly checking and monitoring symptoms. This is what we call a cognitive safety behaviour. Cognitive safety behaviour is what we do with our own mind, and it's sort of like, how am I feeling today? How are my symptoms today? Are they there? What's going on inside of me? And that's the safety behaviour, particularly unhelpful safety behaviour. Sometimes repeated medical tests, and sometimes people feel like, well, maybe there's something else going on. Googling the symptoms, we know, is usually not helpful, and also and again, unless you have very specific medical advice to restrict head movements, we generally try and encourage people to move their heads. Just noting a few comments in the chat box. So yes, Anne saying yes, please resend. A question saying, would you say PPPD affects eyesight as in gaze, or the other way around? Look, I don't understand the relationship between PPPD and visual disturbances, I can say that many of the people, perhaps the majority of the people I see, have visual disturbances. And whether that's, I mean, it's actually not part of the ICD-11 classification, and I don't know whether that's part of the PPPD or whether it's just a common symptom amongst people who have the condition. But many people will say it's sort of out of, my eyesight's out of focus. I go to the optometrist, I have my eye test, they keep telling me there's nothing wrong with my eyes, but I still feel like there's those visual disturbances. And if there are medical practitioners in the room who can provide some answers, I would be very, very interested. And the other question is, how can we access treatment for PPD? How do we connect with specialist practitioners? That is a really good question. I don't take any new clients just because I've only got a small practice and I'm already sort of seeing more people than I can deal with. There are a few others that I can refer to. A lot of what we're doing today hopefully will provide you with most of the information that you need. I'll put together a list of the people that I know who are able to treat PPPD. I know it's a small list, but there are probably about 5 or 6 people who do have some experience or expertise in this area, and yeah, hopefully we'll be able to put that on the website. Good question. Okay, so we're talking about safety behaviours, and there's Peanuts and Snoopy, and Peanuts is saying, oh, I'm staying in bed, Snoopy, it's just 2 people out there. And one of the things that happens sometimes is when we're feeling vulnerable is we just don't want to see other people. And look, sometimes that's totally reasonable, but if it becomes a habit, or if you find yourself avoiding social activity because you're worried about being dizzy, that can actually make you feel low, it can make you feel sad, it can be sometimes a risk factor for depression. And the problem with safety behaviours is twofold. One is that they limit your lifestyle and they impair quality of life. So you end up with 2 problems. The first problem is physical symptoms, and that might be having the physical symptoms of Ménière's. But in addition to that, you have a second problem, and that is that your quality of life becomes very limited. You stop seeing people, you stop doing things, you become more isolated, and that can then lead to anxiety, depression, or other mental health issues. And the other problem with safety behaviours is the direct effect on anxiety. So the problem with safety behaviours is the more we make our world small, the more scary it becomes. And the less you do, paradoxically we do it to avoid anxiety, but the less you do, the more anxious you become. And the more anxious you become, the more vulnerable you feel, and also sometimes the more likely you are to experience somatic symptoms once you move out of your comfort zone. So we're always pushing people to try and go just a little bit beyond your comfort zone, to not make your life too easy or too comfortable. If it's too easy, that's great, but it's not therapeutic. We always want to sort of go just a little bit beyond what feels totally comfortable and learn to surf the symptoms and learn to just relax into the discomfort. So let's have a look at what helps and some of the things that we find useful. And I'm sure most people in this room have heard of mindfulness. We often think of, I think people don't fully understand what mindfulness is. We often think of mindfulness as meditation, and that can be one component of mindfulness. But I'm going to describe it as three different components. One is attention, which is the meditation. One is awareness, and the other one is allowing. And that's when we talk about surfing. That's what we're talking about here. Let me just tell you a little bit more about each one. So when we're talking about mindful attention, we're talking about focusing your mind on one point. And that most commonly is the breath, but you can use sounds, you can use any physical sensation, you can use body scan, and you can do it not only in the sitting position, but you can also do it during daily activity. You can actually be pay mindful attention to eating, and it can actually be, I don't know if anyone here has done the raisin exercise where you just eat one raisin, and it's an explosion of flavour if you actually pay attention to it. You can sit with it for 10 minutes and, you know, just keep discovering new things. You can do mindfulness while walking, focusing on perhaps the sensation on your feet as you walk, or the sound of your breath. And physical exercise presents a great opportunity to also pay attention, to meditate. Things like swimming or any sort of rhythmic exercise is particularly useful for meditation. And the value of that is it trains you to hone your attention on one thing, and ultimately it can distract from body sensations, but it can also help you to create calm and to switch away from ongoing vigilance in terms of what's going on in your own body. Second function of mindfulness is awareness, and that is awareness of what's going on for you as it's happening. And in particular, noticing mind processes as they occur, noticing the overthinking, overanalyzing, worrying. Most people might, many people might say, look, I worry too much or overthink too much, but how aware are you of doing it while you are doing it? So the aim of this is to actually get you to notice the overthinking, to label it. So this is the technical term for this is metacognitive awareness. So awareness of what's going on while it's happening. To label it like I'm overanalyzing right now, and then to refocus. I'm doing it again. I've just found myself worrying, overthinking, overanalyzing. Okay, switch to task, switch to what's going on right now. So getting in the habit, learning to manage your mind so that you don't get lost in minutes or hours of rumination, overthinking and overanalyzing. And then the third component of mindfulness is allowing. And when we use the term surfing, the term surfing comes from the metaphor of, if you imagine that the waves are, imagine that when you're fighting sensations or feeling frustrated, the waves are crashing against you and you're desperately swimming against the waves and trying to sort of fight the waves. When we surf, we just get on the wave and let it carry us. You body surf, you go with it, you allow. And this is really what mindful allowing is all about. So it's don't try to stop the symptoms, but change the way you respond to the symptoms. And it's like surrender. It's just drop the resistance. It is what it is. It's like relaxing into the discomfort, letting your body do what it needs to do, and just letting it be, just allowing the body to do what it has to do. And interestingly, when people stop, and look, it's easy for me to say, it's not an easy thing to do, but if you can learn or you can practice to just go with it and then refocus, it actually helps to bring the symptoms down, or it stops the symptoms, stops somatic symptoms from escalating. Having said that, these are things that you can do when you're dealing with dizziness, with imbalance, with headache, even with headaches, with pain. And in fact, much of the allowing is what we do when we help people to manage pain management and other unpleasant things. Because normally what happens is you're experiencing the primary unpleasant sensation, but you're also internally you're doing this, don't even realize it, but there's a resistance, there's a fighting it. So what we're trying to do is, okay, just drop the resistance, just allow. But that's not, sometimes people can even do it during vertigo, but vertigo is often extremely aversive, and especially with Ménière's, it can last a long time. And even with Ménière's, even though the vertigo can sometimes be very severe and sometimes even feel violent, there is always a psychological component to vertigo. So not only experiencing the physical symptoms, but you're experiencing the psychological symptoms. If you have vertigo from time to time and you don't have it on a regular basis, one of the things that helps people is diazepam, which is Valium, or any benzodiazepine, that's just a category of medication that can reduce anxiety and fear in the short term. Valium can be a very useful drug if you can feel the prodromal symptoms. In other words, you can feel that vertigo is about to happen. It can just help to reduce the impact. But of course, you do have to be very careful with frequent use. Valium is addictive, and once you start taking it on a really regular basis, it can you can just develop tolerance. but it can be really helpful. I've seen a number of patients who just use Valium just to help them through it. And interestingly, if you take away the fear element of a vertigo episode, it's still very unpleasant, but you haven't got two components, you've just got one. It's just a purely physical thing rather than a physical and fear together. I'm just going to have a quick look in the chat and see, is it hard to diagnose? Anthony, good question. Is it hard to diagnose the difference between PPPD and mal de Barquement? Yeah, look, I'd say mal de Barquement is actually a form of PPPD. It is psychophysiological, but the triggering event is usually not rotational vertigo, but usually some sort of motion like you would get on a boat. I see both, and I would treat them both in the same way. Usually the main difference is sort of I guess some of the specific symptoms, and also the other difference is the actual triggering event. Another question is, I'm doing vestibular rehabilitation and therapy at Brain Hub in Gladesville. I'm definitely improving my PPPD. Okay, thanks, Vicky. That's great feedback. So if anyone's interested in that, we know that vestibular rehab can also be really useful. Okay, and exposure exercises. So one of the first things we try and get people to do is to open up their lifestyle. If you're avoiding, or if you're doing, trying to do too many safety behaviours, think about things like just daily walk. Physical exercise is really important for managing any sort of stressful condition. But exercise is medicine, and it's medicine for our physical health. It's medicine for our mental health. If a daily walk is too hard, or a distant but daily walk is too hard, just try a short walk. Just try going up and down the street, or even shorter walk. Any other sort of physical exercise is great. Social activity. We are social creatures. We're genetically programmed to affiliate. We need to connect with other people. And sometimes we have to push ourselves to service relationships, to reach out to people, to make connections. For some people, it may involve going to the supermarket, and if you're feeling very wobbly in the supermarket, you might use all sorts of supports initially. Busy public places, again, gradual exposure into those places, and try and surf the symptoms and distract. So surfing, as we said, is just going with it and just distraction. You can use distraction during exposure. So if you're going for a walk, one of the best distractions is podcasts. And I'd say podcast rather than music. I know some people say, I just listen to music. Music's not engaging enough. You need something that completely takes your attention away from your body. And the perfect exercise, the perfect rehab exercise, psychophysiological rehab exercise, is to go for a walk and to listen to a podcast and to keep bringing your attention back to the podcast. So it needs to be something that's interesting enough that takes you away, that distracts you from being focused on your body. Conversation during exposure is good as well. So again, anything that pulls you out of your mind, out of your body, brings your attention. So other people are really good for pulling you out of your mind. Just the presence of another person in social situations can be helpful. And any sort of engaging cognitive task, and it may be, sometimes I just get people to do simple things like, remembering, what did you have for dinner last night, night before. See how far back you can remember what you had for dinner. If you use social media, what did you see on Instagram? What did you see on, I don't know, Twitter or whatever you use yesterday and the day before? What did you buy in the supermarket? So anything that involves lists and remembering and memory tasks, even getting people to walk and say a tongue twister while you're walking, and really trying to focus your attention on the tongue twister can be helpful. So physical exercise while at the same time engaging your mind in a different direction can be useful for starting to train you to take your attention away from your internal state. So the aim is to get your attention out of your body back into your external environment. And also address cognitive safety behaviours. So many people, especially once they're sort of triggered in an anxious way, spend a lot of time overthinking, overanalyzing, worrying, ruminating. And so typically we might sort of be thinking about, like, why is this happening now? What will today be like? Will I get dizzy when I stand up? Will other people notice? Why did that happen just now? What is the significance of that? Why do I feel dizzy when I'm not anxious? I don't think I am anxious. What's causing this dizziness? Will it get worse? By the way, these are all things that I've heard over and over again from people with PPPD. Will it get worse? This is a new symptom. This time it feels different. There's something different going on there. And we always come back to notice. So whenever you find yourself overanalyzing, overthinking, worrying, just, again, this is where you need the mindfulness practice to start observing your own mind, start observing the processes of your own mind, notice what you're doing, label the process. And when I say that, I mean label by saying, I'm doing it again. That's worrying, or that's overthinking, or that's overanalyzing, or that's rumination. Rumination, by the way, is overthinking past experiences. So observe your own mind, notice that you're doing it, and get in the habit of switching to tasks. So whatever it is that you're doing, you switch back to that task. That's physiotherapy for the brain. Okay, noticing, switching back, practicing to come back into the present environment. Okay, I've got a couple of messages in the chat box, and I'll just mention those. I'd love to be able to do those things, but my vertigo is so intense that all I want to do is make it stop. I'm bilateral. I'm so depressed that I can't take anymore. It's that bad that if I could get off the ground during an attack, I would do something. Yeah, that sounds pretty tough. Yeah, I'm really sorry to hear that, Scott. That sounds, and this is where sometimes for some people the trajectory is really, really severe. And all I can say is don't give up, and see if you can perhaps try and use some of the techniques we're talking about. And someone else has said, I took up ukulele recently, has been a fantastic distraction for my mind. It's reconnecting me with groups of people, something I was very afraid of entering into in recent years. That is exactly that is the perfect thing, Monica. It's about finding something that gives you a passion and an interest, and that takes you out of your brain, out of your body, takes you to something, and especially something that's a connector. Music, playing a musical instrument, even joining a choir, anything that involves doing things with other people. Brilliant, exactly what we're looking for. Okay, and one of the things we try and get people to do is practice mindful acceptance. And having said that, I know for the person who mentioned how tough it is, if you're having really severe or violent frequent vertigo, this may kind of feel impossible. So I'm not, I certainly don't say this lightly, and I acknowledge that for some people this may, this may feel difficult. But I guess one of the questions we often ask is, what would it be like if you gave up trying to eliminate unwanted sensations and focused on other life goals? And I guess with very severe vertigo, that may just not be possible. You're sort of really focusing on trying to manage the symptoms. But is it possible? Think about your own experience. Is it possible to just give up trying to control it and focus on other life goals? And the reason why we say that, I mean, it's so paradoxical, because we all want to not have the symptoms, but focusing on the symptoms too much and wishing that they weren't there just maintains it as a threat. So what we're trying to do is just get people to just, okay, it is what it is, surf the symptoms, really try and engage in other life goals. One of the questions I often ask people is, what do we mean by acceptance? What is acceptance? And I define it as, it's almost like thinking in terms of, it's like the weather. It is what it is. I can't change it. I can't influence it. It is what it is. And in a way, just learning to go with that. And the other question I ask people is, how do you know when you've really accepted something? And the answer is often because it stops hurting. It stops being a preoccupation and it stops hurting. And I know I was just having a chat to Anne and Begina before we started, and we're talking about this whole thing of just accepting, learning to manage it. And when the diagnosis is new, it's so hard to accept. But most people do, or many people do manage to, after a while, accept it. And once you do that, the symptoms sometimes don't change a lot, or the vertigo episodes may still happen, but it's easier to manage. Just want to very briefly get you to visualize. So this will be like 1 minute. And I'm going to invite you to just sit back in your chair and close your eyes. And I want you to imagine accepting your Ménière's, accepting your symptoms, and just allowing them to be there. Perhaps you can see yourself sitting in the lounge room at home, and the symptoms may still be there. You may not be able to control the symptoms, but you kind of relax into the reality of the symptoms. You accept them. And while you're visualizing that, I want you to notice whether you feel any resistance, whether there's part of you that kind of feels uncomfortable about relaxing whilst you still have physical symptoms or unpleasant physical symptoms. And some people will say yes, and some people will say no. You can open your eyes now. But I always invite people to, whenever we visualize relaxing with something that's unpleasant, we very often find that there's resistance there. And when we ask, why do we resist acceptance? It somehow feels like surrender. For many people, it just feels like, we're giving up. I don't want to resist it. I don't want to relax into it. I feel like I need to hold on to that resistance. But paradoxically, when we do resist, why do we resist? People will say, I need to be ready for anything that might arise. Focusing on the symptoms helps me to prepare and stay safe. It's dangerous to relax, ignore my symptoms. If I accept the symptoms, I'll suffer forever. So there's some of the reasons why we sometimes resist accepting or relaxing with the symptoms. And it's completely understandable that after you've had some very unpleasant episodes, you sort of feel that you need to be vigilant. But interestingly, when people do learn to relax, it actually reduces suffering. And most people aren't aware that when you have Ménière's or any sort of somatic symptoms, you have two components. You have the physical aspects of Ménière's disease, and that includes the vertigo, the pressure in the ears, the tinnitus, and other symptoms. But you also have emotional component. And very often people don't actually realize how much the emotional component contributes to suffering. And in fact, suffering actually is physical symptoms plus emotional distress. And for many people with physical conditions, with all sorts of health problems, the emotional distress is a major component of the suffering, even though the focus is on the physical symptoms themselves. And the emotional distress may include things like preoccupation with internal state, never being fully present with the things that you're doing because you're constantly thinking about it. It includes anxiety, frustration, sadness, anger, hopelessness, withdrawal, tension, overthinking and worry. There is often a major emotional component when you're dealing with any sort of physical health condition, including Ménière's. And if we could, so just think for a moment, what component of your experience is emotional distress? If you're dealing with, I'm sure everyone's dealing with Ménière's disease, to what extent does emotional distress contribute to your experience and perhaps to your suffering? And if you are able to eliminate all emotional distress in response to Ménière's or your symptoms, how would your experience be different? What would be different for you if you were able to release or eliminate anxiety or sadness or hopelessness or overthinking, or just constantly being inside your own body? What difference would that make? It's interesting when I ask people sometimes how much of the time they're suffering. And for some people, and again, this is not to understate the really severe cases, such as the case that was mentioned earlier, where there is a lot of physical suffering. But for some people, the physical symptoms are not as severe, or they come and go, but the suffering happens 100% of the time. And the suffering, what they don't realise is much of the time they're suffering because they're feeling anxious or distressed or hopeless or upset. So the emotional experience sits alongside the physical symptoms, and sometimes is the greater part of the suffering. So some other things that help, I've already mentioned exercise. Exercise is, I think, not negotiable. It is probably one of the most important things you can do. Healthy nutrition, and I know with Ménière's low salt diet, obviously, but also making sure you have a very balanced, healthy diet. Trying to get into a regular sleep routine, learning about sleep hygiene and the sort of things that you can do to make sure you get good sleep. Social connection, absolutely vital. And mindfulness and relaxation, I mentioned earlier, I think are also important, particularly when you're dealing with a psychological challenge like Ménière's. When you're in an acutely anxious state, or when you feel like you're going to have a panic attack, one of the things that helps is slow breathing. And there are different rhythms you can take, but just very generally, you can breathe in for 4 seconds, but pause for 2 to 4 seconds, and then make your out breath longer and slower. So breathing out for 6 seconds. There is an app called Breathe to Relax, which is a free app that you can download onto your phone, and you can use that to pace your breathing. So you can actually set the speed of your breathing to whatever you want to do. And sometimes when people feel panicky, they can sort of switch on the app and just practice slow breathing. But it's actually quite a good exercise anyway to get into the habit of slowing down your breathing. And it's a particularly useful tool. You can also put your hands on your rib cage and try and direct the air into the lower lungs, what we call diaphragmatic breathing. Some of you have probably come across it in yoga. That can be really helpful as well. We need to also have some tools for self-soothing. And even if you look at where this particular lady is holding her hands, one on her chest and one on her tummy, that in itself can be quite calming. But there's all sorts of other things that people kind of come up with for self-soothing, particularly when you're feeling vulnerable. For some people, it's distractions. It may be creating things. It may be visual distractions, soothing photos, art or imagery. Some people just even scented candles or oil or vanilla extract with nice smells that kind of take them out of themselves. Or it can be something to touch, like a soft toy, a fluffy thing, a squish ball, beads, and so on, and just even self-massage, bubble bath, etc. So all sorts of things that sometimes we can do to just make our current experience a little bit more bearable, just switching our attention to something outside of ourselves. The final message, I guess, is that we all have one life, and it's happening right now. So don't wait for everything to resolve before you can get on with your life and before you can do things. Get on with your life now. Try to do things now. And some of the helpful goals are obviously to try and, first of all, manage the physical symptoms of Ménière's to the extent that you can. And I'm sure most of us, or everyone here, would be aware of sort of the practical things you can do to manage the symptoms. And beyond that, the challenge is to adapt, to psychologically adapt, hopefully using some of the strategies that we've talked about this evening. And finally, thinking about things that involve finding meaning in our lives. The other thing that sometimes can be useful is a gratitude journal. I know that when things are not good in our lives, we sort of, the idea of gratitudes doesn't sound very, very comforting, but actually gratitudes can be a really useful thing to think about. And no matter how bad things are, there are always some things that we can be grateful for. So that can be useful. I mentioned finding meanings. So think about what's important to you. What are your values? Maybe relationships, friendships, family, career, education, etc. Self-expression, writing a journal, music. I actually should have added music there. Identify important but neglected areas of your life. Anything that could give your life meaning, and engage with that area. Think about doing more of it. Finally, can medication help? And I'm not talking about for the Ménières, I'm talking about for the PPPD and the associated symptoms. We know that for people who are very anxious and find it very hard to control anxiety, there have been clinical trials that have found SSRIs, which are the most common types of antidepressant medications, as well as serotonin, norepinephrine reuptake inhibitors, tricyclics, have all got a reasonable effect on anxiety. They tend to reduce anxiety, they tend to reduce symptoms, and they work for about 2/3 of people who try them. About 1/3 don't respond, or they drop out because of side effects. Okay, so we've got time for just a couple of questions, and I've got one. I've got a comment in the chat box. I eat jelly beans very slowly, one at a time. When I start to feel dizzy, I never eat more than 2 or 3. It's enough to get me to focus on something. I rarely have. It is a mindful treat. So, no, that is fantastic. I love that. That is so good because it's actually sensory and concrete. Jelly beans are great, or if you want a healthier option, try raisins. But jelly bean, I think that is a really mindful treat. It's really what we're talking about is mindful attention. Anything that is a strong sensory distractor is great to sort of bring your mind to and to focus on. So that is a brilliant tool, and I'm going to add that actually to my list of tools. Jelly beans. Does anyone have any other comments or any questions or anything that they'd like to add?
I think you've covered everything nicely, Sarah. It's been absolutely wonderful.
Well, I want to say thank you to everybody for participating. Oh, I also want to just mention my books. If you're interested in, okay. If you're interested in reading a little bit more about anxiety and worry, I have a book called No Worries, which gives you a whole lot more information about how to manage worrying and also change your thinking, 3rd edition, which is about managing emotions and understanding how thoughts create feelings. And I've got and another comment from Vicky saying one of the comedy podcasts I listen to in the morning is Conan O'Brien Needs a Friend. Laugh out loud while I walk. Fantastic. Okay, so that's good to know. Conan O'Brien Needs a Friend. Take note on the podcasts. Yeah, and some nice comments from people. Thank you everybody for your lovely feedback. And I hope that what we've talked about today will be useful to you all, and good luck. And I know life presents us with challenges sometimes, but hopefully we can always keep learning about things that make things a little bit easier.
Thank you very much, Sarah.